Hello everyone, welcome to HIM 225. This lecture is going to cover the chapter review for chapter 15. I'm going to go over the questions from your homework and we're going to look up those codes. In your textbook we're on page 403. And for question number 1, you are asked to supply the code for a patient who has atrial fib with rapid ventricular response. Rapid ventricular response does not impact this code. Atrial fibrillation is I48.9. We verify that in the tabular, and the code you should have selected is I48.91. For question number 3, orthostatic hypotension. So we go to hypotension, orthostatic, I95.1. Verify it in the tabular. We don't know whether it's due to drugs, we don't know whether it's neurogenic, so we choose I95.1. Question number 5, patient has congestive heart failure, rheumatic. So we're looking at failure, heart, congestive, rheumatic, I09.81. And that is the code. That code should be sequenced first, rheumatic heart failure. We have an instructional note to use an additional code to identify the type of heart failure. The type of heart failure is congestive heart failure, and that code is I50.9. So those codes, and as they should have been sequenced, I09.81 and I50.9. Then for question number 7, the patient has congestive heart failure with pleural effusion and hypertension. Now, the pleural effusion is not coded. Pleural effusions are only coded, we learned this last semester, they're only coded if they're treated and they're evaluated. It is not uncommon for patients who have congestive heart failure to have pleural effusions. So with this, for number 7, we're coding the congestive heart failure, which is I50.9, and then the hypertension, which is I10. Now, there was guidance in a coding clinic earlier this year that basically said that we are to assume a cause and effect with heart disease and hypertension. So if in fact you coded hypertensive heart disease with heart failure, I11.0, and then you added the code for congestive heart failure of I50.9, I gave you credit for that. So if you coded I50.9 and I10, you received credit for that. If you coded I11.0 and I50.9, you received credit for that. And then for number 9. And number 9 is a patient comes in with a non-Q wave MI. They're taken to the cath lab for a left heart cath, and they have a drug-eluting stent inserted. Now, the challenge with this is, what do you do with a heart cath? When I recorded the lecture for this review, I pointed out that this left heart cath becomes the approach, and it is not coded. So for this question, we are coding the non-Q wave MI, the coronary artery disease, and the left heart cath. So when we're coding the myocardial infarction, we can look up non-Q wave myocardial infarction, and that code is I21.4. Verify it in the tabular. Then we're looking up the coronary artery disease. I apologize. It seems like my well, I gotta get my fingers right. So for the coronary artery disease, our code is I25.10. We don't have any documentation that this patient has angina pectoris. For some of these questions, you all are assuming that if they have pain, it's angina, but you can't assume that. If angina is not documented, we do not code it. And then, of course, we need to code this left heart cath. And we're putting in a stent. So if we do catheterization in the index, we can see insertion of device in. And so if I go there, I can do artery and if I try to do insertion of device in, I don't find anything. So I'm going to go back to catheterization and dilatation. When I do dilatation, I see artery, coronary, one site. And that's what we have. And this is done. The approach for this, it tells us that the drug-eluting stent was inserted. And so we assume your book has coded this to this approach is percutaneous. And we have a drug-eluting stent and there's no qualifier. So our code is 027034Z. Only one site had a drug-eluting stent placed in it. Now let's look at number 11. And when I recorded the lecture, this particular example included a heart cath, but there was no heart cath performed in this example. This patient has acute coronary syndrome and a diagnosis of coronary artery disease. So they took this patient to surgery and they performed a coronary artery bypass graft. And they used the left internal mammary to bypass the left anterior descending coronary artery. And then they took saphenous vein and they grafted the right coronary artery. They also used the bypass for this. And the saphenous vein that they used was the lesser saphenous vein, and it was harvested via an open approach. So in your book, actually on page maybe 3, it talks about acute coronary syndrome, and it tells you that if you look on page 375, and it tells you that often today that physicians use acute coronary syndrome to mean unstable angina. Then in another section of your book, it recommends that if the physician documents acute acute coronary syndrome that you queried to determine if the patient had unstable angina. For this question, we are coding the coronary artery disease I-2510. But we are not coding it with angina pectoris. We are going to code. There is a code for acute coronary syndrome. If you actually assign the code for atherosclerotic heart disease with unstable angina, I gave you credit for that. So I-2510 is the code that your book uses for this CAD. I-2511 is the code that some of you applied based on the fact that unstable angina is sometimes used interchangeably with acute coronary syndrome. The code for acute coronary syndrome is I-24.9. And we'll verify that code in the tabular. Those are the two diagnosis codes for this procedure. We then are going to code, the diagnosis codes for this particular question. We're then going to code the bypasses. And I can put bypass in the index and coronary. And what we have to recognize with this code is that we have two distinct procedures. This coronary artery bypass grafting was done with an open procedure. And we used arterial tissue. And in fact, the arterial tissue that was used is the left internal mammary artery. So one of your codes would have been 02100A9. Or if in fact you coded 02100Z9, that I also gave you credit for that. If they harvested the internal mammary, then we have autologous arterial tissue. However, if they just unhooked it and used it for the bypass, then it's no device and it's still left internal mammary. And this isn't very specific to me, so either one of those codes would have been correct. Now, the harvesting of the saphenous, that they did harvest it. The device is autologous venous tissue, and the qualifier is the aorta. They go from the aorta down past the blockage, and it's autologous venous tissue that is used. So those are the two bypass codes, and again, it's coronary artery one site because distinct procedures were performed on each of those sites. Then we have to do the excision of the saphenous vein, and this was the lesser saphenous. And it's on the right. 06BR, your book tells you that this was a percutaneous approach, and there's no qualifier. 06BR, did it say open? I thought it said percutaneous. Nope, I'm sorry. It's not percutaneous, it's open. 06BR0ZZ. So that's what your textbook says. Now, this patient was also on cardiopulmonary bypass. And that comes under extracorporeal assistance and performance, and its performance. It is continuous. It is cardiac. It is output, and there is no qualifier. 5A1221Z. For number 13, the patient comes in through the ER with chest pain. That's coronary artery disease following a left heart cath. So what this is saying is the patient comes in with chest pain, they do a heart cath, and they determine that the patient has coronary artery disease. The chest pain is not coded. It is a sign and symptom. The definitive diagnosis is the coronary artery disease. So the chest pain should not have been coded. So I'm not sure why some of you coded the chest pain, but you needed to code I-25.10. This doesn't say that this was angina. It says it's coronary artery disease. And then, of course, we performed the heart cath, the left heart cath. And we're going to look this up, but I also want to point out to you in your book on page 394 in table 15.2, it gives you the codes for the most common procedures, and left heart cath is listed there. So it is under measurement and monitoring. It's a physiological system. It is measurement, cardiac. It is a percutaneous procedure, sampling and pressure. And in this particular example, it was left heart cath, and so we're at 7. 4A023N7. Number 15, the patient comes to the hospital with a pulmonary edema and a history of congestive heart failure, for which the patient takes Lasix and Verapamil. Well, we know the patient doesn't have a history of hypertensive congestive heart failure. They have congestive heart failure with hypertension. And pulmonary edema. Pulmonary edema is not coded. Your book tells you that it is a component of congestive heart failure and that it is not coded. And so we know we're not going to code that pulmonary edema. So it's hypertensive congestive heart failure. So we have hypertension, heart with failure, congestive, I-10.0. When we assign that code, it tells us to also identify the type of heart failure. The documentation we have is congestive heart failure, I-50.9. That's the only information we have, and so that is the code that we choose. So for 15, your codes would have been I-11.0 and I-50.9. Now for 17, this patient has a history of a stroke. They're admitted with atrial fib and dysphagia due to the old stroke. So immediately we know we have a sequela. This is a sequela of their stroke. They have dysphagia because of that stroke. So we look up sequela, stroke, and dysphagia. And the code for that dysphagia is I-69.391, We verify that code in the tabular. It tells us to verify the type of dysphagia, R13.1, and it's actually R13.10, dysphagia unspecified, because it doesn't tell us what type of dysphagia this patient has. And then, of course, we're coding the atrial fib. The patient was admitted with atrial fib. So that is the first listed diagnosis, I48.91. So our codes are going to be I48.91. Then we're going to have the code for the sequela, the dysphagia as a sequela of the stroke. I69.39, dysphagia following cerebral infarction, and then we're also adding the code for the dysphagia unspecified. If you also coded the long-term use of medications, that was fine. You needed to choose the right medication for this particular, for these antihypertensive medications. Now, number 19, patients admitted to the hospital with deep vein thrombosis of the left calf and a pulmonary embolism. Now, a DVT is not a good thing, but a pulmonary embolism will definitely kill you. In sequencing this, you should have sequenced the pulmonary embolism first. If you did not, I still gave you credit for it. I26.99, and this should have been the code that was sequenced first. So the pulmonary embolism was sequenced first. And then we're going to code the thrombosis. And when we go to thrombosis, vein, deep, this is in the calf. It sends us to the index, and we have to choose the appropriate laterality. And when we look at 19, it tells us it was the left calf. So I82.4Z2 was the correct code for that DVT. And again, to find that, I put in thrombosis, vein, deep, and then calf. Then for number 21, the patient had a percutaneous arthrectomy of the right coronary artery for coronary artery disease. So we have to code the diagnosis here. I'm not sure why some of you did not code the coronary artery disease. I2510, verified in the tabular. And then we needed to code this procedure. And in the index, I'm going to put in atherectomy. And we can see that the root operation for this procedure is extirpation. And again, this was performed on the right coronary artery, so that is going to be extirpation, heart, and great vessels. So that's going to take us to table 02C. And it was one site. This tells us that it was percutaneous, so the approach is percutaneous, and there's no device and no qualifier. So 02C, 03ZZ. Then let's look at 23. The patient had congestive heart failure. So they have congestive heart failure. They were treated with a cardiac resynchronization pacemaker. So they're having an insertion of a resynchronization pacemaker. The leads are inserted into both ventricles and into the right atrium. The generator was inserted into the chest via an open approach, and the leads were via a transvenous approach. So, of course, the first thing we do is look up the diagnosis code. They had congestive heart failure. I50.9, failure, heart, congestive. Now we're coding procedures. And in coding these procedures, the first thing we want to do is code the insertion of the cardiac resynchronization pacemaker. So we're going to be, and they actually inserted it into the chest. So let me type in pacemaker. And you can see that if I put in pacemaker, it takes me to table 0JH. I'm going to choose this dual chamber and just choose chest. You can see for chest, they're all the same, 0JH6. And when they're putting in a pacemaker, it goes into the subcutaneous tissue and the fascia. We know that the pacemaker was put in with an open approach, and our pacemaker is a cardiac resynchronization pacemaker. It's not a defibrillator. It's not a cardiac resynchronization defibrillator. It's just the cardiac resynchronization pacemaker, and there's no qualifier. So the code for the insertion of that pacemaker is 0JH607Z. Okay. Then we have to code the insertion of the leads, and we have the leads went into both ventricles, so the right and left ventricle, and then into the right atrium. And so that is 3. We have 3 leads to code. So let's do, well, let's just type leads. I don't think anything will come up. No. And we have insertion of device in, look, ventricle, left and right. So insertion of device in ventricle, let me look at left first, 02HL. And this was accomplished percutaneously. And this is a cardiac lead pacemaker, and there's no qualifier. So this is the code for the insertion of the lead into the left ventricle. If I'm going to code it into the right ventricle, I choose K, and my code becomes 02HK3JZ. And if I'm going to code it, the insertion into the right atrium, I come up here and choose atrium right, and that code is 02H63JZ. So those are the codes for the insertion of that pacemaker. Then finally for 25, this patient had bacterial endocarditis. A Hickman catheter was put into the left subclavian vein, and then the patient received antibiotic treatment. So let's code the endocarditis. So endocarditis, bacterial I33.0. I33.0. Acute, subacute, infective endocarditis. That's it. I don't know how anybody got any other codes for that's how you code bacterial endocarditis. Then if we're going to, then we are inserting a device in the subclavian vein. Okay, so we can't type in Hickman catheter or catheter. So we're going to do insertion of device in subclavian. Insertion of device in vein subclavian. And which subclavian? It was the left. So we choose 05H6. And it was percutaneous. It tells us that it was percutaneous. It's for an infusion, and there's no qualifier. So that code is 05H633Z. And then we want to code the administration of the antibiotics. And so we go to, if I go to administration, it's not blood, other substance. See introduction of substance. And this actually is going into a vein. So we should have an option down here, way down here, vein, central, and it's an anti-infective. I don't see antibiotic listed there. So we'll pick this table 3E04, and the approach is percutaneous. Our substance is anti-infective, and our modifier will be 9, other anti-infective. So our code will be 3E04329. That's going to conclude this lecture. I hope that this helps you review the way that you coded these so that you understand any errors that you made. I'll be happy to go over any specific questions that you may have. Please just let me know. Thank you. That will conclude this recording.